Hi, good morning. My name is Kim Weeks with Weeks Well, and what else would you be doing on Monday morning to start your week than talk about yoga therapy as a lineage on Weeks Well, where we are every single month, sometimes multiple times a month, bringing you roundtable conversations on what lineage is, what yoga lineage is, and why it matters. So we are honestly spanning 5 different time zones in this phone call, which is why for Eastern Standard Time people, or maybe just for Americans, this call is a little early. I know we have some coffee drinkers on Pacific time logging in, and we have a representative from India Standard Time as well. So we're really spanning the globe to talk about this international conversation. And I'm just so delighted to have my roundtable guest of women to discuss yoga therapy as an emerging discipline and profession that is not a lineage, in fact, but draws from many different lineages. So before I introduce my guests, I just want to do a couple of housekeeping things. First of all, we have 3 poll questions for you because our groups keep getting bigger in this lineage conversation, and it's very intersectional. So we're super interested in where you're coming from, what you care about, and what you want to know going forward. So first of all, we have 1 poll question coming up, and that is, are you, Alyssa, you can put the first question up. Are you a yoga student, yoga teacher, or both? Do you mind answering that? That would be amazing. Thank you so much. I'm looking at my questions. I know we had 3, but now I'm nervous and forgot. Oh, thank you. Yeah, this is what we expected, but it's super cool to watch the sort of, can you all see it on your screens? Yo, you can't. Oh, I guess that's just us. So basically we have like almost 80% of attendees who are both yoga teachers and students, which is sort of what we expected. And the second question is, you can go ahead and put that up, Alyssa. Are you a C-IAYT? And we were really interested in that to know, are you a certified International Association of Yoga Therapists, yoga therapy teacher? And yeah, so basically we're looking at, yes, we've got a minority of people C-IAYTs and a majority who are not, but not by much. It's like a 60-40 split. So that's really interesting. Thank you so much. And then finally, how did you hear about this session? We're doing everything we can to kind of crowdsource these through our attendees, our guests' newsletters, through our newsletters, through the ever interesting and changing social media landscape. And so we appreciate you letting us know. We'll have like a questionnaire at the end, so you can tell us what you thought about the session and what you'd like to know more of, et cetera, but that'll come much later. So in terms of the further housekeeping of the session, the chat is closed for you to us, because that's our channel to send you during the session links that we think you might be interested in. Bios, for example, of each of our guests, and also other information that we hope when you attend live, you can hop off of from after the call and do more research or study or learning. Most people we are finding watch this session on recording, so we'll put as many of those links in the comments on YouTube as we can. So for those who are watching this on recording, you can look down below and see that these links that the live attendees are getting. And finally, the Q&A you'll see down there is where you can ask questions as the session goes on. This is a 75-minute session, and we have a couple of really simple questions that I have found over a multiple year period hosting webinars like this one tend to be plenty in terms of creating conversation for learning and direction for you. So if there's more questions that come up from the very simple ones that I start with, do please, of course, let us know. And Alyssa, my producer, who you can't see, but who is behind the scenes pulling all of the levers, I can't thank enough, and also can't thank my guests enough for being here today. So I am joined by a group of yoga therapists, International Association of Yoga Therapists. In full disclosure, I'm currently working with IAYT on some sort of strategic communications work. And in doing that and simultaneously doing this lineages work, it occurred to me, we should really talk about where yoga therapy is on the map of yoga lineage, where it is within the context of yoga teaching and yoga work, basically the profession of being a care provider and a service provider in the yoga industry. And so I'm joined by Saraswathi, who is calling in from Chennai, India. So that was where, if you did see the social post from, Colorado to Chennai, that's where we are in terms of our time zones. And Diane, who is the head of MUIH, and actually let me go back to you, Saraswathi, the founder and director of YogaVahini, which I'm looking forward all the way through for you just to describe what your core work is every day. So there's the link, and again, you can look on the chats. The links are coming through to describe further, because I don't want to take too much more time describing their bios. Not that their bios aren't really interesting, but when I talk about them, they're really boring compared to what you'll hear about them as the call goes on. And so Diane Finlayson is so let me make sure I get the department chair of the MS Yoga Therapy program at Maryland University of Integrative Health, which has really been a change maker in yoga. I am a little biased because I was for 20 years in Washington, DC, and heard a lot about her work and heard a lot about MUIH. So I'm looking forward to hearing more about how this university program has become a fixture in the yoga therapy world, to continue to elevate this profession and this work in a way that in the other self-regulating format of yoga teaching in the RYT 200 and RYT 500 Yoga Alliance credentialing, registration, because Yoga Alliance is a registry. It is not a credentialing body, as I think hopefully everybody on this call knows. So it's just very interesting to see how the RYT 200, RYT 500 is kind of like a moving target, whereas MUIH is clearly not, because it is a credentialed university. And then I have Lois Steinberg, who I'm so glad to see. Thank you so much for coming in today. She's just coming off of a pranayama class like minutes ago. And Lois Steinberg is a Ph.D. She's also an Iyengar yoga teacher and C-IAYT. The Iyengar yoga teacher part is important because she's a senior level 4 Iyengar yoga teacher, which means she's been at that for a very long time as well. And she's calling in from Ohio. Oh my gosh, Lois, sorry about that, from Illinois. And then finally, I have Molly McManus, who's the co-owner of Yoga North International SomaYoga Institute, which I want to pause on for just a second, because this somatic therapy thing I'm really interested in hearing about, if we can, during the call. And she's up in Minnesota. So we're coming from all over the place, speaking in the English language, of course, to talk to you about yoga therapy as an evolving profession and discipline. And I'm going to open it to the four of you. I'm just going to see who wants to jump in first to talk about yoga therapy as this evolving profession and discipline, and not necessarily a yoga lineage. The five of us had a really interesting talk about how to describe this call, and we started there. So who'd like to talk, or first tell us a little bit about yoga therapy as a profession and a discipline that is evolving in the 21st century? Don't be polite, unmute, tell us what you think.
Well, I'll jump in. I don't call myself a yoga therapist, and I'm a yoga practitioner who happens to teach. And in the teaching in our school of Iyengar yoga, from the beginning, we teach how to help students in the class who have common ailments. So if they have, foot problems, knee, back, neck and shoulder problems, how to adapt the poses to include them in the class, not as a therapy. And then as you practice and learn and study more, you do start to learn more precision kind of therapeutics, where you do help people to be comfortable in their discomfort, not necessarily cure them, or to cure them. And so that is different. I do have separate classes for therapy, but I don't consider it as a separate entity. It's all yoga.
Saras, yeah, good. I was going to ask you. I was so taken, Saras, by what we talked about on our prep call about you talking about, understanding yourself and your own mind as a practitioner. Is that where you were going to go, I wonder?
Yeah, I think I fully agree with what Lois was saying, that I wouldn't call myself a yoga therapist. Started learning yoga and continue to learn. And of course, at some point, you get ready to teach, and because you want to share what you have learned. Now, what I discovered over the years studying with Desikachar for over 17 years, and I continue to study with many senior teachers in the tradition, that slowly you realize that you have to change the way you have understood the learning process itself. It's not just learning something, gathering information, learning a skill and then applying the skill. I have to learn to listen, and I have to learn to meditate, inquire into it, practice and experience, and through the experience have an understanding, apply it for myself and for the other. And really this whole thing depends on your state of mind. It depends on how your mind is perceiving a certain reality. So that of course will depend on my practice. And am I able to really observe and listen from a deep, quiet location within me? And that depends on my practice, the strength of my own practice. So I have to keep going back to it and see that it is a very cyclical process, that the more I learn, the more I know how little I know, because we're dealing with human beings. It's not about the expanding number of conditions, but really the complexity of the human being, and so many layers and so many dimensions to the individual. So it is really a meditation. My teacher used to say two things. One is, every student in front of you is your object for meditation. And the second thing is, every student in front of you is your teacher. So they will teach you what you need to teach them. And I think for this, I have to really work with myself. That's where we begin our work, and that's a very, very fundamental aspect of our work, our own practice.
I'd like to know, Diane, from you, I love the two answers. First of all, just to sort of signal, we have BKS Iyengar as a sort of like lineage thread that goes through Lois's answer, and Desikachar, who goes through, Saras's answer. And for me in this conversation, that's important, especially, well, that was important. I want to signal that, and I want to amplify that, because to me, in terms of lineage, those are two important names to think about in terms of the influence on modern yoga. That's number one. Number two, Diane, I wondered, if you can bring it down to this sort of official education level, like what exactly is MUIH, and what is it in the context? I'm sure the people who graduate from your program call themselves yoga therapists. So we have two people on the call who just said they don't call themselves yoga therapists, but are C-IAYTs. And here you are, in a university setting, training people in an MS of yoga therapy. Is that what the actual degree is?
It is a clinical Master of Science degree. So what I tell students when they're coming, and the purpose of our program, my lineage is Satyananda Yoga through integrative yoga therapy, and I've studied also with various Shivananda teachers. So that's the angle through which I approach the work I do. And I've been to Bihar and been with spent a lot of time with various swamis in my tradition. And I totally agree with everything that has been said thus far. The program exists as a clinical master's level program at an accredited university. because I had a moment in the 90s, early 90s, where I was wondering what life needed to be. And I thought, people kept telling me I should be a therapist, and I did not want to be a therapist because I just felt there was so much more information, interoceptive information available through the body that talk therapy did not scratch the surface of and didn't understand how to make the connections with. And I'd been to a couple of trainings at that point, and I thought, what I need to be is a yoga therapist. So I've been kind of after this for a few decades, and really have wanted to make it so, not to replace or change anything that's already going on in other various traditions, but to, I think, educate and bring yoga, therapeutic yoga tools into settings where they can be of use in a way that they would not get looked at if the student was not clinically prepared at the graduate level. So that's really my aim. And when I talk to students who are considering the program, I talk to them very clearly about what they want to do. If they do not want to work in a field with licensed healthcare professionals, if that's not their path, then there are many other beautiful ways to incorporate therapeutic yoga into a practice, or even yoga therapy of various sorts. So this is not the only way, what we're doing. This is a way, and it's a way to, in my mind, to help Western-oriented healthcare providers understand and honor the ability of yoga to affect change in their patients. Boy, that was a long way, wasn't it?
No, I really like the last thing that you said. First of all, distinguishing that there's more, I mean, the first teacher training that I did was in 2001 or 2, and I lived in a tent on the, integral yoga ashram. And every day I went in for my, this sort of all truth paths are many, truth is one, paths are many, and so it's difficult for me not to think about that sometimes. So I hear you saying something similar to that, which is talking to your potential candidates, I guess, and graduates, that there's more than one path, but they have to be sure if they're going to go to MUIH and graduate from it, that they want to practice. They want to
infiltrate polite society and alter conventional medicine.
I love that. Molly, talk to me about that. I see you nodding your head.
Yeah. Well,
and Molly, by the way, as I said before, is the chair of the board of IAYT, the International Association of Yoga Therapists, and has a really another angle on this sort of official infiltration approach.
yeah, absolutely.
So talk to us about that.
Yeah, absolutely. Well, first, I want to say that, I feel, for me, it's important to say I'm a yoga therapist. First and foremost, I'm a yoga student, and I always will be. That is my first role and should always remain my first role. But the fact that we have this profession, this ability to start reaching out in other communities, is one of the reasons, is because we're professional. We're making this professional version of this where we can talk to people at a level, that think that Diane's talking about here, and I think we're all talking about. And so for me, it was important to say yoga therapists, and that our students that graduated from our programs can say that, because they want to work in either medical care, or they want to work in different areas where they have something that gives some legitimacy right behind the name. And I like talking about that a little bit, because I have a really different path to yoga. I'm not from traditional colleges and things like that. I really came to yoga from my own healing, and then really stayed and dug deep. And so I loved what Saraswathi was actually talking about, saying, you know, this is about knowing who you are and actually starting to become really lucid and clearing the way so that you can hear and you can listen and you can develop relationships within the world of yoga. And I think that's the piece that I think that I love to mine from this, is how we help our students, you know, learn to do that, to start to clear themselves of some of the barriers. I mean, I think that's so much of what yoga is learning to clear the barriers to wholehearted and whole being health. So that's one of the things. And then as far as for a field, you know, I'm working with IYT. I've been with IYT for a long time. I was on the accreditation committee for a long time, accrediting schools, and then came over to the board, and I'm board president now. And so, you know, I feel like it's because we're trying to help this field govern itself, to make sure that this field is saying, we have standards we're applying. We want to have people be safe. We want to be able to make this work accessible. And we want to be able to bring this work out into the world in different ways that it hasn't been able to be brought out. And so that's why I think it's important to you know, think about it as, you know, from that perspective for me.
There's a bunch of different directions I want to take this in. I want to sort of pin the conversation on oncological work, since I know that's in Western global. I'm not sure how it is in India, Saraswathi. I'd be interested, but I'm sure you're well aware, in the US, like oncology research and oncology work is where so much of the money is, frankly. And you do see, even in the scientific research on yoga, which is, I've done a ton of work on with Sapir Singh Khalsa, who's coming in for Lineages in exactly a month with Stephen Cope to talk about a bunch of different things. But anyway, we did a lot of work on that. And he's, of course, continues. And that's really where you see so much of the research. That's just where the money is right now. So that's one thing I just want to pin. But another thing I wanted to sort of demarcate, and this makes me think about this training, Lois, that you do, that Sunday 4-part session for Iyengar yoga practitioners specifically, but I think it has like broader implications as it observes the sort of threshold that a yoga teacher, okay, somebody who's just trained to teach what, ? Because again, in this self-regulating market, everybody's interpretation of RYT 200, RYT 500, and in the Iyengar yoga case, I mean,
It's years, decades.
Yeah, it's like RYT 500 times 5. I mean, it takes so many more hours to become an Iyengar yoga teacher. But in any event, a basic yoga teacher is not able to address and personalize the whole person while also handling structural and organic problems. Would you all say, and Lois, I just want to sort of maybe just start with you, since we're going around the carousel, the wheel. Would you say that that's the demarcation between being a basic baseline level 1 yoga teacher and a yoga therapist?
Well, like you said, you know, I recently had this adaptations course, and that's a stepping stone. It's what every teacher should know, which I said earlier, to include everybody in class, you know, so you don't exclude anybody. That's the first thing. You know, people don't like, you know, a lot of students, if they come in and they say they have a problem, they say, but don't do anything special for me. They don't want to be excluded. People want to be included, even though you may know, oh, if I can take you to the side and do something separate, it would really help you. But they don't want that. You have to do what the student wants first and just include them in the class. And it's a stepping stone. And then the next step is what I call categories of poses, where you take the standing poses, inversions, backward bending, forward bending, twisting, body nodding, supine poses, and you teach the categories and how to modify them. Like I have some setups here. Barb, maybe you can get into cross bolsters. So you teach categories of poses. Again, it's not necessarily, I don't give sequences per se. but you learn categories of poses to understand how to further adapt poses for healing purposes, not just to include people. And so this is a combination of two poses. It's Sedubandha Sarvangasana, Dvipada Viparita Dandasana. And depending on the person's condition, if they have depression, I would let their head go back. So there's different things to do from the crown of the head down, not really the legs, because low back pain is contraindicated if bending backwards hurts. But we can work on the organic body from the brain onwards. And you have to know these classic poses and how they affect the body. And then we're combining the two poses and how it's modified. And you want to make the apex of the pose, so to speak, where the problem is. So maybe it's the thymus, maybe you have an immune system problem, you want to support the thymus gland, the primary organ, or maybe it's the lungs, it's the heart, it's diaphragm would be the apex if you have asthma, for example, if it's the intestinal system, if it's the reproductive system, or the large colon, etc. So it's done in different ways. So you learn categories of poses, and then the next step is actually learning therapeutics, where you sit down and you learn how to do an assessment of the person's problems. Usually there's a lot of comorbidities, a lot of problems together, find out what it is of all their problems that they would like to accomplish first, because it might be different than yours. And make up a program using the different categories of poses to help with the healing process. And some of the healing process could be poses that are similar for everybody. So for example, a lot of times in a therapy class, everyone starts with this pose, but it might be done different according to their problem. Maybe they have high blood pressure and they need to have, just for quick, let me just, the head higher for high blood pressure. Maybe somebody, has a reproductive organ problem. So everybody can do the same pose, but it's modified according to them. And then and all of this is to rest the body. You have phases of rest. The whole practice is divided into 3. You have rest, 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 and then rest, active, rest, and then active, active, rest, depending on progress or not. And then you start changing the program according to their response and their needs. But this takes a long time to learn. And so just to get back to where I started, first, you just have to learn how to include somebody versus how to heal somebody or help them to live with their condition. Thank you.
I'm interested, thank you, Lois. I'm interested in responses to what Lois said and also demonstrated on a couple of levels. First, one of the things I'd love to pull out as a thread in this conversation is the difference between a general yoga class, a therapeutic yoga class, if or as it exists, as Lois just described, and then yoga therapy, which is, I think a lot of people think about it as a one-on-one exchange. Like you said, Diane, people are telling you to be a therapist, and you were like, there's like more to the body interoceptively than just sort of talk therapy from the brain solving whatever problems. So can we talk about that? Like, how do the other 3 of you as yoga therapists approach your profession, approach your sessions with people?
So like I said, in our tradition, we don't differentiate yoga teaching and yoga therapy, because from the beginning, from the day I started teaching or learning, it was all individualized. I was 21 when I came to study with this Acharya and actually work in the institute. And I was taught an individualized class. And it is completely breath-based. The teacher does a consultation, they do a complete assessment, and they choose a kind of postures, modify them according to the needs, design the practice, teach, and that is progressively adapted to your changing needs. And that's how I learned yoga therapy. So I started teaching normal, healthy young people, and slowly, little bit of complexity was introduced, minor problems. And the teacher would always give the practice that I have to go and teach the student. and I come back and I have to really explore why this has been given, why this combination, why this breath ratio, why this meditative focus, why was the diet modified, and all those things. And then, of course, there is a lot of learning about this, but a lot of things I found was very intuitive. I would never have the courage to ask Desikachar, why did you give this practice to the student? But I have to go back and explore and try to understand why this particular modification of Trikonasana, and why this counter posture, etc. Then, as years passed, I found that the healing happened so miraculously, just with simple practices, focusing on the breath. And for me, it was really the interest was to understand how the change is happening. How is the transformation happening? At one level, it is a conviction of the teacher. Like if I receive a practice from my teacher, because I have the conviction in my teacher, I would go and practice it, and it would make some change. The conviction of the student, what we call Shraddha. So there are so many factors. It's not just the tool or the technique. There are so many factors that are involved. And to understand that and explore that and see how this is working, that was really my quest. And in my training, it is professional training, and I'm so glad that we're able to really structure the training in a way that every time we're experimenting, saying, okay, how do we really put together all the information you gather about a student, your observation, the interviewing, and everything, and then design a beautiful practice that's individualized for that individual. And then how do you progress? And every time you are reaching a roadblock, like student doesn't practice, or they feel this is not going to work for them, or they don't understand how this is working, how do you go back and work with yourself and your teacher and come back and help the student? So it's a long process. And in this, you begin to see that the whole framework of yoga and Sankhya and Ayurveda and the Upanishads and everything begin to unfold, because there are so many lenses through which you have to see the individual, right? The optics through which you see the individual. It is that individual and who's experiencing that illness in that particular context. I have to begin to see the whole thing unfold. Only then I will be able to help. And we keep going back to the Yoga Sutra. We keep going back to the evolutionary model of Sankhya and Ayurveda. And every time these lenses help us to see the person from a fresh perspective, because it's a live living model. It's not just based on a certain disease. And then how do you communicate that to a medical practitioner? How do you help them to understand that this is a different lens? You know, it is not disease centric, it is individual centric. It is not so much just focusing on a part of the body, but the whole individual. And it's it is about the process and not about an input and output kind of a thing. So how do you really communicate that? And that can only happen when they see the change. So we collaborate and we work with people. We say, you do the assessment, we'll do the teaching. And you find out for yourself what's the change that's happening. So it's a very exciting process. But for a professional yoga therapist, it is hard work, because you have to go back and dig into yourself. It's not simply learning a skill and saying, okay, what can I do for this condition or that condition? You really have to work with yourself. And very often people think it's very easy. They just need a manual, but it's not like that, right? It is really like a meditation. Yeah.
Thank you. There are three things I'd like to bring out from what you said. And I would be so curious if people on the call do feel like being a yoga therapist or even being a yoga teacher is easy. I mean, I'm thinking back to my very first yoga class. I had 200 hours. And I'd been taught a formula. I mean, integral yoga taught me a formula to start this way, teach these sun salutes, do exactly as Lois described, these specific sets of poses afterward, and then in the class in a shavasana. And I had a much older woman who had a bunch of comorbidities. I had a young woman who had sacroiliac issues, and I had a third person with something else. And that was my very first yoga class. And it was 2002, and I like raced home at 7:30 in the morning, the class is 6:15, and just started Googling these particular issues that I had been confronted with. And that was the beginning of my yoga teaching. And, 20 years later, I still don't think I know anything. And so I first want to draw an important distinction for the audience between what Sarah said and what Lois demonstrated with her assistant or student. I heard you say, Saras, that breath-based is your approach. And quite obviously what we saw from Lois was a physical-based and supported structure. So we don't necessarily have to talk about that too much, but just to say that these lineages are coming through to yoga therapy on slightly different paths. So that's just one thing I wanted to say. The second thing is, I want to be sensitive in these calls to the Sanskrit we, sort of throw around, because a lot of people may or may not be able to quickly translate it in their minds. Also conceptually, what Saras, I heard you say is that, yoga therapy, like yoga, modern yoga, is coming from Sankhya, from Ayurveda, from the Upanishads, from the Yoga Sutras, and as we did describe in our marketing material, from the Vedic traditions. So the third thing I wanted to talk about is translating this stuff to the Western medical sort of model, or the medical model. So I do want to get to that, but let's just stop on these multiple threads of knowledge, these books, these teachings that have come through to all four of you and make it into your teachings today. We could start with Vedic and talk about what that is, or talk about Sankhya and talk about what that is. I think those would be the two important places to just tell the audience a little bit about why that has any impact at all on modern yoga therapy. Who wants to take that?
I'll go just for a quick minute, if that's okay.
Great, sure.
So we find the students who come to the university from the quality of student who's coming to the university has changed in the 10 years we've been offering the program. And I've been involved with it since it began. And in the beginning, a lot of students really did not have any clear connection or underpinnings for yogic philosophy. They were taught asana. They'd gone through an RYT 200. They were quite proficient at asana, but they did not have the subtleties or the understanding of how those things they were taught were linked to various traditions. So one of the, in my mind, most important things we do in the first year of this program is to teach people about Indian philosophy and traditions, to teach them the difference between Samkhya and yoga and the connections between Samkhya and yoga and the other Shatdarshan, and also look at the various scriptures that have influenced yoga and have impacted the way people like Saraswathi are talking about, you've got to know your mind. Lois is talking about very deep therapeutics, energetically and physically as well as subtly. So, but where does that all come from? If you don't know about the Gita, if you don't know about the sutras, if you don't know about the Upanishads, if you don't know about Samkhya, you don't know. And in my opinion, you cannot then practice with integrity. So we would like our students to be able to practice with integrity. And in order to do that, they have to understand the source that all the material they're using comes from. Or, and you've got to have that baseline of knowledge too, to do the whole person health that Saraswati is talking about, because it's not just the body, it's everything. My background, the work I've done primarily has been with people recovering from various substance use disorders, as they say now. We used to just say addicts, but and there's a lot to work with on all layers of a person's being. So the intake has to be clear about, and, talking about intake, a lot of the students who come to us don't know what an intake is because they haven't been trained that way in some of the RYT 200 programs. But if you're going to do a good whole person intervention with somebody, you've got to know what's happening for them on a variety of levels. So that, and you can't do that unless you understand why you're asking the questions, not just what are the questions, but why do these questions matter?
Totally. And, can I pull that out and sort of just piggyback on the three things I was, the two of the three things that Saras was talking about to keep moving them through the conversation. How do you do it as a yoga therapist or as a yoga therapy? I mean, I could answer this myself. I've been teaching for 20 years, but I'm not a yoga therapist. And so how do you filter this whole bodied knowledge of not just yourself, but of the student, of the client, of the patient in front of you, to the Western medical practitioner? Lois, I know you work with the University of Illinois a lot. I mean, when I was at your, you don't. When I was at your training, there were tons of doctors in that room. There were people who were coming over. I mean, at least I was practicing right next to a bunch of them, young people. So so that's one question. How do you filter that? How are you bridging the gap? I mean, this is for Molly just as much as for Lois, for any of you, because I know this is a big part of your job.
Yeah, I mean, Kim, I could speak a little bit to it because it is part of our job, but one of the main aspects of it is actually being with the person or the people that we're serving, that we're supporting, and actually helping to educate them first and foremost, right? To actually, I feel like often I say this phrase, like, we don't know how we work, right? We don't know about our anatomy. We don't know, unless you've, taken a course of study, we don't know about our regular physical anatomy. We don't understand how our brain works. We don't know the options for the ways we can start to see ourselves. And so I feel like when people come to yoga therapy, they're seeking deep peace. And whether that's because there's a physical ailment happening, whether that's something that really began in the mind and has come out in other ways, this is the conversation here that to have, and to start saying, there's this thing called the koshas. There are the layers of our experience. And sometimes if we can have a person start to consider themselves as more than just one dimensional, there's a path for healing that is more about them healing themselves than anything I'm going to do. Once they can just start to, walk that path. Now, being able to reflect that back to the medical community, I mean, I think what we're seeing is the medical community is saying, oh my gosh, we need something else because this isn't working the way it is. And so I feel like what I see is the medical community starting to come our way a little. And we're, of course, trying to learn how to speak very clearly, take things from Sanskrit in a way that we translate, but maybe for me, making sure that I also keep the Sanskrit, that I also remember that that is where the basis and the foundation is. I have a responsibility to yoga. I have a responsibility to the Vedic traditions for myself to make sure that that is where I teach from, right? That it is the sutras and the Gita and all that. I mean, this is what has given us so much. The other thing I just wanted to say about this as well is I think, one-on-one teaching is where we get so much good work done. But the fact of the matter is I teach a weekly class on Zoom, and I did teach weekly classes in studio for a long time. And that's often where people get curious and maybe get hopeful and maybe say, there could be something different here. And so I want to keep being able to use cueing that is opening, builds curiosity, interoception, that kind of stuff, so that it's actually a person going on and, looking and being lit up a little bit inside, saying something might be able to change here. And I haven't had hope until today. And now I want to start to look at what is possible through yoga therapy. So that's something I think it's really important that we give some credit to what classes have done, yoga therapy classes and yoga classes in general, is they've given people openings back to themselves in many ways. So I just want to make sure that we got that there.
That's great. And Lois, I'm really curious as to your thoughts on all this, because, well, I'm just going to stop there. What are your thoughts?
Well, I have many thoughts. I'll try to limit it. One thing is that, I agree with everybody. I think we all agree with each other, and the importance of the philosophy behind the yoga. We certainly require it, when we certify teachers. The thing about therapy, though, is if somebody's coming to class, to be helped, in a personalized sequence, I don't start pushing philosophy on them at all. That's the worst thing you can do. It's like, start teaching them about the yamas and niyamas. They just feel bad. And the point is, you want them to feel better. And we do include breath, by the way, in this pose. It's just first observation, to relax the abdomen on exhalations, to soften the tongue, the steps to get to observe, mostly to get the person to be quiet. And usually I, don't really talk to people because I want to get them absorbed in the pose. I'm not going to be teaching them philosophy while they're in the pose at all. I'm just helping them to be quiet and come to their own true form. So that's my one thought on that.
I was actually reading right as you were talking, because that's my job during these sessions, is to listen to you, is to have multiple chitta-vrittis occurring at the same time while I'm trying to help people still their mind. But when you say bringing the body or the person back to their true form, can we talk about that a little bit? Because it seems to me that that's what I've been hearing from all four of you in such profoundly, frankly, different ways. And oh shoot, somebody. Anyway, so can you talk
that's a yoga
about,
sutra.
What's
It's the third sutra. Then you come to yoga stills. Now is now we start yoga. Yoga stills the fluctuations of the consciousness. Then you come to your own true form. Otherwise, you're not. We're always in that. Otherwise, we're not. But in terms of like asana and how it helps you to come to your own true form. Say you're a depressed person. You cannot be a depressed person when you're doing a back bend. You cannot be a depressed person when you're doing a back bend. People are depressed, love back bends. That's all they want to do because it takes them out of their depression. They're finally in their own true form, even if it's just for the moment. Hopefully it lingers for some time. Hopefully you didn't overstimulate the student and make them manic in some way. But there's poses that help you to come to your own true form. So, yeah.
Well, yeah, that's okay. That's thank you. That was I'm really appreciative of that more information and a question. I lost the question. Let me just read this to you all. So to the audience, we still have 24 minutes. Please ask questions or make comments if you'd like, if there's something that you're hearing that you'd like to be, pulled out here. Somebody says, an anonymous attendee, yoga is a practical form. So just looking at a manual will bring little gain, most likely, I think. I think what Lois demonstrated is a physical form in the Setu Bandha cross bolsters when she had her student assistant showing that back bend and was describing, I heard no fewer than 5 or 6 different aspects of the pose that could be the apex or the focus that allows the breath to move and flow in different areas of the body. I like that yoga can be made more available to the general public, but I would hope that the art and science of yoga would not be watered down. And so piggybacking on that, I guess the question that I'm sort of wondering about with regard to the Western medical model is how it seems to me that we are at a place in time where everybody is trying to become more, I think COVID just sped this up, become more whole-bodied. Like I was just emailing somebody this morning, some sort of organizational mindfulness clients. And to be frank, I'm not sure that teaching mindfulness in the workplace is actually happening so much anymore, because as a result of the privilege of having a hybridized workspace and being able to like log in and go in or not go in or whatever, people are either extremely more stressed by those boundaries having shifted, but also recognizing that the de-stressing isn't necessarily going to happen at work. Like, I've got to take care of this in my own personal space, at the yoga class I go to, in whatever self-care, practice or discipline I take on. So how do we keep it seems to me that the Western medical model just tells people what the problem is. Here's your problem. Here's your diagnosis, and here's the path, without asking the person what they want to do about that, or what their true form, as Lois is describing, might look like in attempting to coexist. I heard you talk about this on our pre-call, Diane, coexist with this thing that's happening inside of you, this manifestation, Molly, as you said, of the mind, or this expression of the thymus, or whatever. So I know I've put a lot of things in there, including anonymous attendees' thoughts and mine, but thoughts to any of it?
So when we send the students into work with licensed healthcare providers, they are working in some ways in a, if you will, bilingual setting with that licensed healthcare provider. But the point of the student or the intern yoga therapist going into that environment is to be able to provide the whole person care that licensed healthcare provider may not at this time be able to. And, and back and forth, one of the big discussions in the current membership, yoga therapy membership, is about, should there be licensure or not? Well, one of the reasons that a yoga therapist can go into a Western medical environment and spend the time to do the work is because there aren't the same pressures on them that a licensed healthcare provider might have. We take students into Howard County Medical Hospital, where they do practicum work. Molly has been with us in that. And the change on the whole ward is profound. When the students go in, the charge nurse is like, when can you come back? Because the social workers aren't being called every 5 minutes. The chaplain isn't being called every 5 minutes. The charge nurse isn't having her bell rung for drugs every 5 minutes, because people are being taught ways to self-regulate and manage, because these students who are in practicum have the time to spend to attend to the true form of the person in distress in the bed. So it's not either or, it's both and, I think, in many cases. Thanks.
Yeah, I just feel like the clause of the century is but/and. I just think, I think everything we say finishes with but/and. What else? What else do you all on the call? I've got a couple questions coming in. By the way, you can upvote any of the questions or comments that you see, so please feel free to do that. But back to what we're talking about, anything, Saras, Lois, or Molly, that you'd like to?
I'll just speak quickly, because you brought up COVID, and we're dealing with long COVID, and this is something where our current medical system, maybe they can handle it, but usually not, because of the medical system itself. It's so specialized. So there's so many body systems that long COVID affects, like you have to go to one specialist for one thing, another specialist for another thing, and so on. Whereas, we can handle if somebody has multiple issues, for example, like headache. There's different kinds of headaches, and in our method we have like a flow chart, how to, because there's different kinds of headaches even, and maybe you have back pain with that headache, and maybe you have sinus congestion and all this kind of stuff. And so a lot of, even in yoga, you might have to cancel out one pose because of another condition, but we know how to do that. We know how to take the whole body with the different presentations of how somebody's affected, not just long COVID, but by chronic illness,
Mhm.
and all the comorbidities. We don't have to, have a specialized thing for one thing, and then you have to go to another thing, and nobody's communicating to anybody in the medical profession, but we know how to bring it all together for that personalized program that the student would need.
That's great. Anybody else? I got a couple questions coming in that I can ask. Okay. Okay. Is there any yoga pose that is not therapeutic in any way? That's a trick question, I think. Anybody want to take that? I can try.
Well, BKS Iyengar would, I have a story. One day he told me in practice, he said, you need to start holding the poses longer, because as you age, you should hold the poses longer. And so I came in the next day and started holding the poses longer. And he said, don't hold a bad pose long.
Oh, good one. That's a good answer, actually. If that doesn't answer your question, Tomami, please let us know. Anybody else want to take that? No? Okay, sorry, I'm having a hard time scrolling down for the other questions. Are you gonna talk, Lois? Oh, sorry. So somebody says, it's so good to have this conversation with the different ways yoga sees health integrated as a whole person. I think our strongest communication with conventional medicine is seeing that it works. And, one of the things I was thinking when all of you have been talking about, Saras, back to you were saying, I kept thinking about how much we need to know of our own mind and how much we therefore need to be able to respond to in the truth of the whole person as they present themselves to us. And one thing we haven't yet talked about so much, but I've heard from all of you, is what the person says that they want and how they describe, how they show what their issues are. When I train my teachers all the time, they'd say, well, the person said this, or the person has this problem. And my question is always, what did they say? What words did they use? And, and also, what did you see? But what words did they use? So can we talk about that a little bit? Like how the person is interacting with you and how that influences the outcome of their health and wellness path or disease management path, exactly as you were saying, Lois. You said something really well about that in the pre-call, but I can't remember what it was.
I think there's a lot of kinds of listening that we have to do, right? It's not just with it's certainly what a person says, I have this pain or this is what's happening for me, but it's also how you are able to interact and begin that, as we've talked about, transformational relationship where they actually learn to mind what's in their own mind because you're willing to listen, that you're finally willing to hear what's really going on with them. And I feel like that's an important part of what we do is learning to listen. And I think Saraswathi, I think everybody's brought that up so far. And so that's a big piece of it. And then helping a person start to consider, what is it, a yoga pose they need, or is it something around actually learning how to be more present and more conscious, actually getting rid of some of the things that are getting in the way of that. And that's going to be what brings more peace. I think we deal with a lot of complex issues, physical and mental health issues in our world right now. That's what I see a lot. I myself even have a complex physical diagnosis, and knowing that I can be in a state of health and well-being, even with a complex disease, is something that I think is so important to be able to start to bring into the conversation. That it's, I may never be the same form of healthy I was before that, or my student might not be, the person that's coming to sit with me, but they will find more well-being if they can work with yoga therapy and all the different, layers that we do. So I think that's part of that conversation for me.
When a student is talking about their problem, we are listening. There is an actual problem, maybe knee pain or headache or depression or whatever. And then the problem of the problem. Like, how much is that bothering them? How much are they identified with it? What are the narratives that they're holding around it? And so the whole field of avidya, the raga, the dvesha, and the fear behind it, the whole thing comes alive. So to listen to all of that and to be able to then tap into probably something much deeper, that if we're able to touch, then many of these things begin to shift, because the subtle is always more powerful than the gross. And instead of sometimes working at the gross level, you go into a subtle, say, a cause for the problem and help them to see it differently. Just when the perspective shifts, many things can change.
Totally.
So listening and observing is a very huge part of our work, and continuously afresh. Each time the person comes, you have to be able to see them afresh, because they're also changing, you're also changing.
It also strikes me, going back to all of, at least the Vedic texts that I've been exposed to and the Yoga Sutras, that when you embrace the belief and the practice that the self inside of you is the uppercase self, the universal self, the listening to yourself is listening to other selves. So the more you go deep inside yourself in your own practice, the more you are empowered to do that for other people. Is that true for you all? Is that a true statement? Or how does that resonate with you?
I think there is a danger in getting into this, because sometimes we start thinking about it. We start believing that we already know what it is, right? And then we base our thoughts, base our actions on that. All that I can say is that is what the philosophy says, and I believe in it. In a very quiet moment, I'm able to see that there are many things that are happening that don't touch me like the way it does normally when in a normal state of mind. But that's how far I can go. Yeah, I truly don't know. I have not experienced Chitta Vritti Nirodha or Tada Drashtu Swarupe Avasthanam for me to truly say that. But I definitely know when the mind becomes quieter and clearer, something shifts. You begin to see your reality differently, and that seeing can change many things. And the direction is very important. It's not about being established in something or saying, I am established in this, because I want to really bring in the Vedantic perspective. A lot of people who are deeply rooted in Vedantic studies say, oh, I am not this body. But I ask them, does a knee pain bother you? Yes, it bothers me. Then you're still connected, you're still identified with the body. So what we think intellectually and what is really our true experience is different. And to know that difference is very important.
That was great. What about, I have a couple of things I want to pull from the Q&A, but I see some of you also looking at it. So any comments on the back of Saras's beautiful statement?
In working with a client also, we really encourage people, our students, as they prepare to do work with clients, to, as we're talking about listening, you know, they may see that, or they may see on a form that, you know, there's frozen shoulder or some kind of knee problem. But if the client isn't there for the frozen shoulder or knee problem, that's not where you start. You start with what the client needs to ease their suffering. They're there for a specific type of suffering that has a hold of them. So you start by paying attention to what they're telling you and attending to what they need, because when they go to some other healthcare provider in the Western systems, if the Western provider sees the frozen shoulder or knee issue, they're going to go right there and not deal with the rest of it. So the blessing of doing what we're doing is we can attend to them where they wish to be attended to. And then afterwards, if that thing is still an issue, that other thing we saw, it could resolve if we're working with the primary issue they're telling us they have. But if it doesn't resolve, then if we've built a good therapeutic relationship with the individual, then we can work on that as well when they're ready.
Mhm.
It's all about
So-
when ready.
Yeah, so we have 8 minutes, and I want to land this plane and give everybody the chance to sort of say one last thing or say anything that may be, on their mind about, and of course, what's on my mind is this, intersectionality is like, I think about it all day, every day, because I'm so grateful for, I don't know who or when or how we really amplified this word of intersectionality, all these intersections of different professions, truths, backgrounds, realities, everything. And the intersection of yoga therapy with the Western medical model is one of the things we talked about wanting to address here, how you're doing it, how IAYT is doing it, how as yoga therapists you believe you are working with it. And I've heard lots of examples during our call, but Deborah, has said the general public has been conditioned to treat the symptom versus fix the problem, and are so geared to ask for medication to fix it or treat the pain. And then she goes on to say, as a medical professional and a yoga therapist, understanding the locus of holistic care is one of the most important things we bring to the table as a yoga therapist. And those two comments, I think, are a nice way to summarize your missions in life, because I know we're all here devoted to this word yoga and devoted to what we do within the context of that practice and teaching. So Molly, would you like to start as we kind of go around the table to finish off with those two comments?
Sure. I think first is the most important thing is for each one of us as teachers to keep being students. That is to keep learning, to keep diving deep within our own practices and our own, becoming more and more conscious and more present every day. I think that's the first thing. And then as we try to get clear, making a path for our students that are coming to us for training and helping them with that, learning how to hold projections, learning to work with all those kind of things that come forward to us when we're teachers of teachers. And I think that's a big piece of it, so that we can help, grow up this field, which is, it's been around. This field of yoga therapy as a professional field is young, while yoga therapy and yoga is old. And so it's like that intersectionality there is really an interesting thing to be dealing with. As far as the work with IAYT, keeping the idea of a way to manage the field well, to hold ourselves accountable and to keep making sure that we're serving well the whole community. That's the thing that I think IAYT is really trying to do with its commitment to expanding knowledge around the profession and commitment to diversity, equity, inclusion, and accessibility within the field of yoga therapy. So thank you.
I would like to answer somebody's question, how to get a student to trust you more as a yoga therapy. Well, doesn't end quite right, but how do you get them to trust you? And it comes back to that rest phase of practice, because simply resting is healing, and we don't do enough of that. And often in Pune, where I spent years, I would see them months at a time just doing the same rest program with a student, whether it was for what their problem was or not. And then they'd see a certain reaction in their eyes and their skin and their breath. And then they'd be like, okay, they're ready now. But the rest is really important. And the rest can build a trust. You feel better. And another way to build trust is, again, coming back to making them feel better. An example is I had a student who was coming for a heart problem, but he also had a heel spur. And he was also, I live outside of my town. It's a farm community. It's, very conservative people. And this guy drove from very far, and, he was a very conservative person, and he comes in kind of very closed. And I was helping him with his heart and his heel and whatever else. And after a few sessions, he comes in and he says, I don't know about this yoga, but my heel spur is gone. So then they start to trust you because they feel better. And I think also we have to be careful when we use yoga to help people feel better, is that we can be just as wrong as medicine, or in the way of thinking in terms of, here's this drug, it's going to cure you, when that drug could, like kill your liver or whatever. There's a price to pay, but people want drugs to instantly feel better. And in yoga, people want a sequence to instantly feel better. A lot of times they say, I don't give sequences. There are some sequences, okay, to make you feel better, but it shouldn't be like that. That mind has to change. It's not like one size fits all. You can't just ask for a sequence for something. And so we have that problem. The other thing is, in terms of connecting with the medical community, often I tell my teachers, hey, when you go in and tell your doctor that your heel spur is gone or whatever, bring a picture of what you've done, bring photos in, bring Light on Yoga in, bring one of my books in and show this is what you did. And be sure to say yoga. I ask them, tell them Iyengar yoga, because that's the school I'm from, but it's not they don't understand yoga. It's not what they learn, just like doctors also don't learn about nutrition even. But the more they hear it, maybe something will ring a bell. But I had a student who had a crushed leg and, helped him, and he was feeling better from the yoga therapy more than the PT. And when he went to see his doctor, he asked, the doctor said, are you still doing PT? Yes. He said, but Iyengar yoga is helping me. This is what's really helping me. And then the doctor says in his recorder, patient's still doing PT.
Oh
it's just, they don't hear
Yeah.
it. It's
Right.
not in their lexicon. So you have to be proactive as a patient in the medical community to say, this is what I'm doing and this is what I'm helping. And maybe if enough people are saying it, they might understand and listen.
This is great. And in like a minute or two, I just want to make sure Saras and Diane, you get the chance to say sort of your final thing, because this is the reason that I'm doing this, is to teach the teachers, is to educate on the intersectionality, and to create, especially with regard to this particular call, the medical practitioners who do exactly what Lois just said. They can't hear it, and they think of, I can't tell you how many times I've heard somebody say, well, my doctor says I can't do yoga because of my back. I can't do yoga because of my this. I can't, it's like, but anyway, Saras and Diane, especially with regard to IAYT, if you want to become a yoga therapist, go there. There are all of IAYT's accredited schools. You can look at the organization. Is so wonderful and will help you in 6 ways to Sunday to understand how you might plug in to becoming a yoga therapist. But Saras and Diane, let's end the call with you, with anything else you'd like to say for the many questions. Thank you so much that have been coming in. They're so interesting. And all of us on this yoga path.
I think we need to look at illness as natural as birth and death. Yeah. And it's not like once I get rid of one problem, I'm not going to get another problem. So it is really about change at many levels. So we can say from the illness samskara to the wellness samskara, many changes I have to learn to make with my diet, with my lifestyle, with the choices I make, the way I live my life, my attitudes, my deeper samskaras, narratives, many things. So slowly, hopefully, the practice will help the mind to be quieter, so one can start looking at oneself and really learn how to make these deeper changes that are more sustained. That it's not just about getting rid of a symptom, but really learning to heal from within, which can be transformational, really transformational. And I think that is a path of yoga, truly.
And Diane, thank you, Saras.
That transformation is the thing, that's the key. And that's why I wanted to be involved in yoga as a therapy, because seeing those transformational changes in people is it's just stunning. When we train students, I do tell them, back to the medical people for a minute, that, and students as well, that you know, the clients they're attending to, the fundamental thing that the students who come through our university are going to have to do is educate on what is yoga, why yoga, when yoga, how yoga, not protocol yoga, but individual yoga. It's about evidence-informed practices, not protocols. It's about understanding not just the medical research, but the philosophy, and finding the way to blend the two so that the doctor can hear you and understand how to tell their patient about yoga, and so that the patient understands who to see when they're seeking additional care as they're going through their healing process.
That was amazing. Oh, I could talk all day. I feel this way every single time. And I'm so grateful to all four of you for, you know, logging in at so many different times of your day. Saras, thank you so much for ending your day with us, and for the rest of you, especially, well, Central Time or whatever, for starting our day. And for those on the call, thank you so much for, you know, logging in. We will send, and we probably already have posted, you know, a survey, because we want to know how I did, how we did, how the call was, and what more you'd like to know, because I do think, as Diane says, to end this thing, that this is about education and teaching the various constituencies that whom we are working with, to understand what exactly it is we're doing, and the value, the transformational value of what it is that we offer and practice. So there is a recording available. You've been spammed basically with links on all four of these women all the way through the call. So please avail yourself of that. I think multiple people on this call are authors, have books, have amazing sites. So please look into all of that if you can, and be in touch with us. I'll be back with, well, on Wednesday with Matthew Sanford, an Iyengar yoga teacher, who's going to be teaching on the universality of asana. On Wednesday, he is a wheelchair using Iyengar yoga teacher, and is going to talk about his journey with that and what that looks like. With regard to yoga lineages, on June the 21st, which also happens to be Stephen Cope's birthday, Stephen and Satbir will be joining me to talk about lineages from their perspective. So I hope you can join us. It's all on our website, weekswell.com. And I hope to be in touch with all of you. Thank you so much. And thanks for your extra 5 minutes, especially to the guests. Bye.
Thank you, Kim.
Thank you so much.
Thank
Take
you.
care.